Okay, now let's talk about relations of spleen. Relations of spleen. There are two kinds of relations, one being peritoneal relations and the other being visceral relations. Visceral relations we have already talked about just a few seconds back. We were speaking about the impression for the fundus of the stomach, for the left kidney, that is a renal impression, colic impression, pancreatic impression. These are all the organs which are related to the spleen. So we have already talked about the visceral relations. We're talking about peritoneal relations. The spleen is basically covered by peritoneum everywhere except at the hilum. Except at the hilum, which corresponds to the margo intermedia or the intermediate border. Now, from the hilum, there are two peritoneal folds which extend, one to the stomach and one to the left kidney, and they are known as the gastrosplenic and the linorenal ligament respectively. Let me write it down for you. One is known as the gastrosplenic ligament and the other one is known as the linorenal ligament. Remember that these two ligaments are extremely important. Okay, now talking about if we talk about the gastrosplenic ligament now, as the name suggests, gastro and splenic, it extends from the stomach to the spleen. Now, where on the spleen? At the hilum. And where from the stomach? From the upper 1/3 of greater curvature of stomach. Upper 1/3 of greater curvature of stomach. Now remember one thing, ligaments and peritoneum always act as a conduit for vessels and for different structures. So the gastrosplenic ligament, also the linorenal ligament, will act as a conduit for some vessels or for some structures, right? So gastrosplenic ligament contains something, it acts as a conduit for the short gastric vessels. Fine. Now talking about the linorenal ligament. In the beginning of the video, I've told you that the word line refers to the spleen. Okay, the word line is derived from Latin, right? So lino renal. Renal means the kidney. So you already know the extent of this ligament. It extends from the spleen to the kidney. Where on the spleen? From the hilum. And on the kidney, where on the kidney? Anterior surface of the kidney. Now, linorenal ligament acts as a conduit for two very important structures, which you should never ever forget, because these two are extremely important clinically also. Now, these two structures are one being the splenic vessels, and the second being the tail of the pancreas. Fine. Now let me discuss a clinical aspect of this. As you know, the tail of the pancreas is related to the linorenal ligament. Okay, you might have heard of splenectomy. What is splenectomy? The word tummy means removal, right? So the removal of spleen basically means splenectomy. Now, when is spleen removed? I'll be discussing about all this in the later part of the video. But spleen is removed in certain infective diseases where excessive hemolysis is occurring in your body and your RBC level is falling. So splenectomy is done. And also spleen is not very essential for life. A person can survive without a spleen. So splenectomy is done. So when splenectomy is done, the linorenal ligament and the gastrosplenic ligament are also cut off. Fine. Now, if the surgeon or the person doing the surgery is not careful, he might cut the linorenal ligament in such a manner that the tail of the pancreas, which is embedded into it, is also cut off. So imagine your pancreas. Imagine this is your pancreas. This was the tail of the pancreas and it is cut now. Do you know a very important characteristic of the tail of the pancreas? The tail of the pancreas contains the maximum amount of islets of Langerhans. This is the place where alpha, beta, delta cells are found. Fine. So there will be severe insulin deficiency in your body, which will ultimately lead to diabetes mellitus. So this is an important clinical aspect of the lienorenal ligament, of the tail of the pancreas, of splenectomy. Remember this. Now let's talk about the arterial supply of spleen. Now, spleen is supplied by the splenic artery. Spleen is supplied by the splenic artery, which is basically the major artery supplying the spleen. Now, where does the splenic artery come from? It comes from the celiac trunk. Where does the celiac trunk originate from? From the abdominal aorta. We'll be discussing more about the blood supply of the entire abdomen in a separate video, wherein I'll be explaining it to you in a very better manner. And we have already discussed that the splenic artery is embedded or lies in the lienorenal ligament. This is all about the arterial supply of the spleen. One more thing that you should remember is splenic artery, unlike a lot other arteries, is not straight. It is tortuous. Now, why is it tortuous? It is because spleen is a distensible organ. Like, it moves a little with respiration, along with the fact that it has the ability to enlarge up to 10 times its original size in case of splenomegaly. So in order to conserve its blood supply, and so that its blood supply is not cut off under any circumstance, splenic artery is extremely tortuous. Like, imagine a straight wire. We will never be able to stretch it more, isn't it? But if you have a wire like this, which is tortuous, now if you stretch it, it will allow distensibility. It will allow itself to be stretched or expanded a little, isn't it? So therefore, the blood supply of the spleen will not be cut off under any circumstances. That is why the splenic artery is extremely tortuous. It is an important viva question which is often asked by examiners. Let's talk about the segments of the spleen. Now, if I make a rough sketch of the spleen, this is the spleen. This is the hilum of the spleen. Let us suppose that this is the hilum of the spleen. Now, this is the splenic artery entering into the hilum of the spleen and then dividing itself into two branches. Now, this branch will go and supply its own territory, and this branch will go and supply its own territory. There is little to no anastomosis between the territories of these two individual branches of the splenic artery, because of which there exists an avascular plane between these two territories. What does the word avascular mean? Avascular means no blood supply, isn't it? So there is a plane existing between the two territories where there is no blood supply at all. So this is known as the avascular plane of spleen. Avascular plane of spleen. Something like this will also be seen in kidney. There the plane is known as the avascular plane of Brodel. So do not be confused between both of these. In the final part of the video, let's talk about the clinical anatomy of the spleen, which is important. The clinical anatomy of spleen. The first being accessory spleens. Accessory spleen. Now, in case of fetal life, the spleen is present in the form of small condensations of mesenchymal cells. This is during fetal life. Later, they fuse together to form a single mass of tissue, which is known as the spleen. Sometimes these individual mesenchymal cells do not fuse. They do not fuse or they fail to fuse. It leads to a condition known as polysplenia. leads to a condition known as polysplenia. And these individual mesenchymal condensations are known as splenunculi. They are known as splenunculi. Now, remember, these splenunculi, where do they lie now? Like, since they are not fused, then of course they will not lie in the left hypochondrium, just like the original spleen. So they lie somewhere. They lie in a variety of different regions, such as they lie in the gastrosplenic ligament, they lie in the linorenal ligament, they lie in the greater omentum of stomach, and in some cases they also lie in the broad ligament of uterus and spermatic cord, like of the left side. Now, if you ever get a question asking you about the most commonest site, the most common site for polysplenia or splenunculi, or the commonest site of accessory spleen, then the answer to this will be gastrosplenic ligament and linorenal ligament, followed by the greater omentum of the stomach. So do not forget this. Now, if we discuss the other, also one more thing that I did not mention before was, while drawing the superior border of spleen, you might have noticed, if this is the spleen, while drawing the superior border of the spleen, I made it anterior surface or the anterior portion of the superior border a bit notched, isn't it? Now, what are these notches? These notches are known as fetal lobulations. Fetal lobulations. Now, why are these lobulations present? As I've already told you before, in fetal life, spleen is present in the form of small splenunculi or mesenchymal condensation, and then they fuse together to form a single spleen. So this is basically a remnant. This is basically a remnant of the mesenchymal condensation that were seen in fetal life. So that's it. So it also acts as a very important mark for you to identify the anterior part of the spleen. Like, once you identify the superior border of the spleen because it is notched, now if you want to identify which is the anterior part of the superior border of the spleen, then you should understand that the fetal lobulations are present on the anterior part. Okay, on the anterior part of the superior border of the spleen. So this is a way you can identify the side of the spleen also. Like, side as in the side as in the orientation of the spleen, because there is a single spleen, you need not identify which is left or right. So yeah. Okay, let's talk about the second clinical, that is splenomegaly. Splenomegaly. Now, spleen is a very highly distensible organ. It has a capacity to enlarge 10 times its original size. Now, spleen is usually not palpable at all unless it has enlarged 2.5 times its original length. Fine. Now, what are the cases in which the spleen can enlarge? It can enlarge in malaria, in case of Kala Azar, in case of cirrhosis of liver, in case of chronic myeloid leukemia, isn't it? So these are the cases where the spleen can enlarge. Now, if the spleen has enlarged a lot, like to 10 times its original size, okay, it can enlarge towards the right iliac fossa. Like this is the original position of spleen. This is the original position of the spleen. Now, since it has started enlarging, it will start enlarging from the left hypochondrium, then towards the umbilical region, and then towards the right iliac fossa. This is the path it follows while enlarging. Okay, now you might wonder that why doesn't the spleen enlarge downwards? Like, it was much easier for it to go downwards, isn't it? But it does not. It goes towards the opposite side instead. Now, this happens because its downwards extension or distension is restricted by a ligament known as the phrenicocholic ligament. Known as the phrenicocholic ligament. As the name suggests, it extends from the left colic flexure or the splenic flexure to the diaphragm. One more thing that I would like to discuss with you guys is there are two more angles related to the spleen. These are the anterobasal angle and the posterobasal angle. Anterobasal and the posterobasal angle. This is the anterobasal angle. This is the posterobasal angle. The anterobasal angle lies lies at the junction of the superior border and the anterior end, whereas the posterobasal angle lies at the junction between the inferior border and the anterior end. Now, the anterobasal angle is also known as the clinical angle of spleen. Clinical angle of spleen. Why? As I've already discussed before, the spleen has the ability to enlarge, and when it enlarges, it goes towards the right iliac fossa via the umbilical region. Now, in such a case, the spleen becomes excessively palpable. Now, when the clinician palpates for the enlarged spleen, the first prominence that he feels for is the anterobasal angle only here. So therefore it is known as the clinical angle of spleen. Therefore it is known as the clinical angle of spleen. Last but not the least is BAT. What does BAT stand for? BAT stands for blunt abdominal trauma. See, usually the spleen is a very protected organ since it is protected by the ribs, but it is prone to injury by blunt abdominal trauma. Now, what is a blunt abdominal trauma? Such as a road accident or being hit by an object. So, the spleen in that case can rupture. When the spleen ruptures, the splenic blood can irritate the left dome of the diaphragm. You know that the diaphragm has got two domes, isn't it? Left and right domes. So the splenic blood can irritate the left dome of the diaphragm, and this pain is referred to the left shoulder. This pain is referred to the left shoulder by the left phrenic nerve. Now, what is this thing called? This is a very important sign which is known as the Kerr's sign, whatever you call it. This can be framed as a question. And it has been asked as a question in previous years also, because this is a very important clinical sign. The case might come up as a person who has recently suffered a road accident comes to the emergency department, and the patient complains of left shoulder pain and was hit on the left side. Now the question might ask you, which sign is it? So it is a Kerr's sign. Why is it caused by? It is due to the irritation of the left dome of the diaphragm by the ruptured spleen, that is the splenic blood which irritates the left dome of the diaphragm, and it is carried to the left shoulder. So with this, we have come to an end of our discussion about spleen. If you like the video, do like it, share it, and subscribe to my channel.